Good afternoon, everyone. This is Dr. Bhupesh from Dr. BKM OET Institutes and all the YouTube followers, including the students of Dr. BKM. Thank you so much for following us. And tomorrow, as always, you must be waiting for this video that what would be the exam tomorrow. Again, it's not something I know what would be the exam tomorrow. It's something that being in medical profession, that there are not many things which happen in our medical profession, because if patient is getting hospitalized, then patient will be discharged, then we will call it hospitalization letter. If patient would be coming from GP going back to GP, we will call it refer back letter. If patient would be coming from a place like retirement home going back to the retirement home, so we are discharging back the patient to the retirement home. So that is why they are known as referred back letter, discharge back letter, hospitalization wala letter, visit letter when there are multiple visits given. All these letters are referral letters at the end of the day because you are referring the patient to a professional. But today, I believe again, I was thinking that I would teach you discharge back letter today, but somehow now I feel that why not do during hospitalization wala letter as well, because it has been long, this letter has not come. So let me tell you about this during hospitalization types letter, and then I will talk about the other letter that can come. So again, there are not much letters in OET, so I do not tell you what can come. I can't even comment upon that, but I can let you know what kind of things happen in medical professions. So what happened? A patient is getting hospitalized due to maybe myocardial infarction, maybe due to complication of diabetes, maybe due to fracture, maybe due to fracture. Oh, there is one more thing. Patient, you might be a dental nurse. Today, I got one of the calls from a dental nurse who wanted to join our institute. So, yeah, dental nurse can also come. And you can be a physio nurse. That means you are a nurse working at a physio clinic. You are a nurse working at a dental clinic. So, all these things, these two letters are typically different, obviously, because you don't have much idea about it. And then we have got hospitalization wala letters. So let me tell you how to deal with it. So patient is getting hospitalized due to various problems, then second step, you will treat the patient. If the patient is coming in the hospital getting hospitalized, so second step is treating the patient. Third step, after the treatment, obviously patient will get better. So if he gets better, so what will you do? You will discharge the patient. And when you are discharging the patient, obviously there would be some follow plan after the discharge. Follow plan is known as discharge plan. That is why they are known as discharge letters or hospitalization letters. So what is happening? Patient is coming to you, getting hospitalized and getting treated, then getting discharged, and then you want someone to follow the discharge plan. So if the patient's condition has improved, who will follow the discharge plan? It can be the local GP, it can be the community nurse, it can be the district nurse. So these are the people, or maybe the family GP. So these are the three major uh, professionals who will take care of the discharge plan. So if I have to write it to the community nurse or the district nurse, again, this kind of a letter can come because it has been really long time. But I will also tell you about the discharge back letter. So stay focused, stay tuned. I won't take more than 20 minutes, I promise. This letter is being written. Uh, I think maybe OET is fed up of this pattern. They think that mm, all the letters are being written same. So today I'm changing it. It does not make a difference. I'm writing this letter. Let's write it this way. Don't think it's a pattern. It's just a way of writing. I'm writing this letter regarding Mr. X, M capital, who was admitted to our hospital due to problem, whatever the problem that we have discussed, myocardial infarction, complication of diabetes, multiple sclerosis, whatever the problem is. So what will happen after that? Second step, treatment. So you will say after treatment, his condition is better. Obviously, that is the second step. So what will happen? So he is being discharged. If patient is better, why will you keep him? You will obviously discharge him. And that is passive voice, comma and so. Please note this thing. Full stop after treatment, there is a comma. So comma means pause. After treatment, his condition is better, so he is being discharged. However, he needs follow-up care. Whatever is given, follow-up care word, whatever word is given, use that word. However, he needs follow-up care, or however, he still needs. Still is also a very good word. That means even after getting better, he still needs follow-up care. So he is being referred under your, he is being referred to you. Or if you do not like the word refer, if you want to keep it only for senior surgeon, so he is being sent to you. That is also good. But refer is a medical word, so I prefer it, even if you are sending to a community. That's how simple it is. Second paragraph, you will tell the community nurse that Mr. X is a smoker and drinks as well. Now you will ask, sir, social history, what should we write? What should not we write? It depends upon the discharge plan. If discharge plan says that encourage the patient to quit smoking, that means then it is very important in the, this is in the last paragraph, discharge plan. That is what we are talking about. Then obviously in the in the social history, you will tell na he is a smoker. Only then you will be able to say in the discharge plan, quit smoking. If you do not tell here that he is a smoker, how can you write that encourage the patient to quit smoking? So that is what social history is all about. If there is any point in the discharge plan that says about educate the patient regarding diabetes, so that means in this social history and medical history, second paragraph, you will say his medical history reveals that he has been suffering from diabetes since 2005 or since last 7 years. Now, again, I always mix it up because I don't teach things separately. I want to make it simple for you. So now this is the tense, present perfect continuous. This gives you A grade in grammar, more than 450 marks in grammar, because writing has many things. How do you write? How do you write the purpose? What grammar you use? So this is the special grammar. The best thing that you can do, if the patient was a smoker and he is not smoking now, then best word can be used to be a smoker. Only in the condition when patient was earlier smoking, now he is not smoking, then you use this word. Otherwise, simple, patient is a smoker. If he has quitted, then he used to be a smoker. I'm generally saying if the patient has quitted, obviously this cannot be in the discharge period that encourage the patient to quit smoking, because this means that he has already quit smoking. So discharge plan mate will never come that he has to quit smoking. That is how logical OET letters are. That is how simple OET letters are. We all are nurses. We know if patient used to be a smoker, that means he is not a smoker now. So how can it come in the discharge plan that he needs to quit smoking? It cannot come. So these are the small things which you already know being nurses, and just behave like a nurse in the exam and you will automatically pass. Just take care of this grammar, take care of the purpose. So the main purpose is not this. Main purpose is follow-up care. If I have to make this letter very small, then I can also write it this way. If I have to make this letter very small, then I can make it this way as well. I'm writing this letter regarding Mr. X who needs follow-up care, so he's being referred to you. Even then you will pass. Even then you will pass. If your letter is very complicated, you do not understand, just try to understand whether it is a follow-up care, it is any other kind of care. What is the main purpose? So this is the main purpose. And this, my dear, helps you to pass, because in the first paragraph, when you use different kind of grammar, examiner automatically understands or comprehends that you are good at grammar and everything. And in the first paragraph only, story becomes clear. that he was a case of myocardial infarction or multiple sclerosis. You treated the patient, he is better, so he's being discharged. However, he still needs follow-up care, so he's being referred to you. This is better. Two times, so I can understand it doesn't look nice. So you can say he needs follow-up care and he is being referred to you. That is how simple grammar is. Use a simple word and he is being referred to you. Why are you? Don't overthink. If you are liking two times, so let it be. If you do not like it, change it and he's being referred to you. Okay. You don't like, oh, sir, and he's repeating. Okay. Now it's okay. Okay for everyone. I hope you don't mind it much and rather you like it. He needs follow-up care for which he is being referred to. Now that's okay for everyone. So don't get over confused. What should I do? What should I? Don't overthink, yeah. Come on, it's very simple. OET. Then comes the third paragraph during hospitalization. Now, what kind of grammar would you like to use in during hospitalization? So you will say during hospitalization, the patient complained of active this and this thing on examination, just like visit letter. On examination, he was found with or assessed with this and this thing. After that, he was diagnosed with whatever the condition has been given. This and this thing for which treatment was given. Whatever treatment you gave. Suppose if he was a case of myocardial infarction, after that he was diagnosed with myocardial infarction, for which bypass surgery was done. I'm just taking an example. I'm not very pro at medicine, but yeah, bypass surgery was done. Now, if you want to use better, if there is other consequences that as a result, his condition got better. So he has been advised to get discharged tomorrow. That is how he has been advised to get discharged, or he has been, or he is being discharged. But it's just to change, just change the tenses. He's being referred, so he has been advised to get discharged, or he is being discharged tomorrow or today, whatever. Means again, don't make anything complicated. Okay, you don't want to get confused. All right then, fine, yeah, that's fine. Then last paragraph, you will always start it with this way. It would be greatly appreciated in that. It would be greatly appreciated. Please ऐसे लिखना. If you could encourage the patient to do this and this thing, whatever is given in the discharge plan. Second, kindly do this thing. First form. After kindly, always first form. Because these are imperative sentences. Kindly sit down, kindly stand up, kindly educate the patient, kindly encourage the patient, kindly motivate the patient, kindly support the patient, kindly assist the patient, kindly help the patient. So this is a very simple sentence. Then you make a passive voice. Suppose if you have to make passive voice of this thing, encourage the patient. So you write the patient should be encouraged to quit smoking or to take diabetic diet. That is how simple it is. The patient should be encouraged. Sorry, I will make it better. Encouraged. Yeah. So B plus third form. This is passive voice. If there is any other point, it is also important for the patient to go for regular walk, matlab whatever has been given. End of during hospitalization letter. How simple. If you count the word 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13. I'm not counting these words because I have missed some. 14, 15, 16, 17. If I will write out the words. 17 into 10 is around 170 words. And we have to write 190 to 200. So add one line to it. And again, if you will write all the words over here, it will become 190. That is how simple OET letter. This is it. To get your 400 marks, that's it. Done and dusted. All the grammar is here. All the commas are here. Whatever you want to know is here. Again, social history and during hospitalization and whole data selection will be dependent upon this paragraph, because this is the main purpose. This is the follow-up care that patient needs, that he should be encouraged to do this thing. It is important for him to do this thing. It is important to assist the patient. Or if you have to do something, it is important to dress the wound daily. If there is something that you need to follow, that nurse needs to follow, जिसको आप letter लिख रहे हो, it is important to dress her wound daily and assist him in daily exercises. That is how you make good sentences. I'm just giving you an example. That is how you guys make good sentences in OET. That is how simple OET letters are. This is how easy you can make your OET. And I will upload this letter on the YouTube and you would be able to see this letter today. And I believe that tomorrow during hospitalization, wala letter can come because it has been long. Otherwise, I was thinking discharge back letter has not come. So let me tell you the discharge back letter now. So I hope you're all sorted with this. Please watch this video again. I'm just trying to save time. So total overall, I told you at 9 minutes that I will take 20 minutes. Right now the time is 22 minutes. So overall, I have taken 13 minutes to write this letter. That is how simple it is. 13 minutes you need if you know everything. Now discharge back letter means, suppose if the patient, and this also has not come for a long time. Suppose patient is uh, staying at retirement home or maybe orphanage. Suppose means patient is somewhere or maybe resides in a nursing home. So that means patient lives over there. He is a resident. Sometimes in the exam, in the last, it would be given, write a letter to manager Elizabeth Nursing Home. And maybe you will not realize it is a discharge back letter because at no place it will be given that it is a discharge back letter. But in on the front page, it would be given physical address of the patient as Elizabeth Nursing Home. Please try to understand this point. I'm going to explain you again. That means how would you recognize it is a discharge back letter? You are writing a letter to the manager at Elizabeth Nursing Home. Patient's address is Elizabeth Nursing Home. That obviously means patient is living in Elizabeth Nursing Home. He came to your hospital and he is going back to Elizabeth. So the names are same, Elizabeth Nursing Home. So you need to trace it. That means patient is coming from here, going back here. That means this manager or this nurse, if you have to write it to nurse, she knows or manager knows about the social history and medical history. So you don't have to write the social history or medical history of the patient. Very important point. Very, very important. So how would you write this? Let me tell you again. How would you write this? Now, again, let us copy paste. So today I'm not writing this letter is being written. I'm just changing it. You can still write this letter is being written. Again, not a problem because nobody can object this. I'm writing this letter regarding Mr. X. I will say regarding your resident, Mr. X, who was admitted to our hospital due to this. After treatment, his condition is better, so he is being discharged back. However, he still needs follow-up care and you are advised to follow the instructions for his speedy recovery. That's it. No more changes. Otherwise, I normally write that, however, I don't write this word. Then you say, this is better. Obviously, this is better. You can follow any method, but this is better. I will tell you why. Once he, yeah. So now understand this. I'm writing this letter regarding your resident who was admitted to our hospital due to this. His condition is better, so he's being discharged back. Once he reaches there, once he reaches there means back at your place, you are advised to follow few instructions for his speedy recovery. So that is what this is the main purpose. Follow the instruction for his speedy recovery. So patient came from here, going back here. That is why it is known as a discharge letter. Now, why should I leave the last one? It also will take 2 minutes. Referred back letter. It can repeat anytime. That's why yesterday I told you to do that Suzanne Matthews letter. I sent the videos to all of you. If anybody doesn't know about that Suzanne Matthews letter, I will put a thumbnail in the end of this video. Please click on that typical OET letter. So I will put it as a thumbnail after this YouTube video. Just at the end of this YouTube video, you will find that thumbnail. Referred back letter means this letter is being written. Okay, let us copy paste now. Why we are writing. That is what OET is all about. Copy paste. All right, there you go. I'm writing this letter regarding. Now I'm writing for the GP regarding your known patient. So he knows GP. So that means he's a Mr. X who was admitted to our hospital. After treatment, his condition is better. So he's being discharged. I will remove the word back. Now, being his GP, you are requested because GP we request. In this case, we advise because we can advise to the nursing home people. But GP is a doctor, so you would request. Now, being his GP, you are requested to provide him the required care for his speedy recovery. That is what you can tell to his GP. And this speedy recovery word is not mandatory. You can remove it if you don't like it, if it does not fit in your letter. So now the main purpose is regarding your non-patient, Mr. X, due to this, better, so he's being discharged. Now being his GP, you are requested to provide him the required care. If follow-up care word is given, remove the word follow-up care. That's it. That's OET for you. That's OET writing for you. The easiest of all the things in the world that can happen with you ever. And these small things can take you and help you to become an overseas nurse just like that. So please don't worry. Just sit in the patient calm. Just sit in the exam calmly and think what my patient needs and to whom I am sending the letter. If I am sending the letter to the orthopedician, that means I want to refer the patient because patient might be having fracture. He must be suspected with fracture or he is diagnosed with fracture. If I am sending the patient to a cardiosurgeon, if my letter is to write to the cardiosurgeon, then obviously I have to find something related to heart, myocardial infarction, angina pectoris, something else. If my letter is to the neurologist, I have to find something related to brain. To the pulmonary specialist, I have to find something related to lungs. That is what data selection is all about, and being medical professionals, who else can do it better than you? This is Dr. Bhupesh from Dr. BKM OET Institutes. Again, trying and tell you that OET, it's not a heavy toil of work. Please subscribe our channel if you have not, and keep watching our videos to know everything about OET and to know how easy OET is. Thank you very much for your patient hearing again and again. And we'll see you with the next video very soon. And I hope you like this video. And now I'm going to put the thumbnail for that Suzanne Matthews letter as well for the people who are having exam tomorrow. Thank you.